are these people?
We're going to talk about universal healthcare in a different way. We kind of want to wait. I know Mangione is, obviously the big hot topic right now, especially given now his charges have been upgraded to first-degree murder and terrorism, which I'm like, you really want to go down that road? Okay. So as I said last week, we want to wait. Not to say we won't talk about it, but unless it's something more substantive, rather than just more sensational, then we feel will be important. Then we will talk about it more specifically regarding the case.
Yeah.
But, but I did want to, not to say I wanted to bring this up. I was kind of inspired by talking about this, listening to Savvy the other night. I know she talked about how universal healthcare relates to race. And she used mainstream media to kind of make a point. So, which behind the scenes, not to say it was kind of contentious when we were playing this last night, but you and Indy had, you had some
Thoughts?
valid arguments to be had regarding the article that I pulled, which was from mainstream media, but I think just overall the issue regarding universal healthcare. So we're going to do what we normally do is we're going to talk about it. I know you probably have some stuff you want to say about it. And if Indy's in the chat, feel free to add your 2 cents.
Yeah.
But I'm going to talk about this and talk about it from my perspective, given, as I said earlier, universal healthcare is definitely one of my top issues for me personally regarding my health, for my family's health, for those who live in this country, like my mom, who, my mom was a nurse. I've been very blessed to have a healthcare professional who kind of warned me about you need to do this, you need to do that in order to kind of maintain your health. Because as the saying goes, health is wealth. Basically in terms of like being able to do the shit that you need to do and not having to worry about how that's going to affect your job and your families or whatever. But I also kind of see this in terms of my work, seeing children, who may be behind on immunizations that they need, who may not be able to see a doctor when they want to, or, a lot of healthcare issues that as a teacher, I kind of have to partner with families to kind of help address. So, but the argument is that universal healthcare, or the lack of it, is tied to race, or at least that's the saying, is that the reason why we don't have universal healthcare is because of Black people. I think it's a little more, it's not to say it's complex, it's a little more, there's a lot more to it than that.
I've never heard that being the reason, or anywhere close to. I mean, maybe that's your culture.
I have, right? I have, but as you and Indy was sharing yesterday, I think this issue is a lot, not nuanced, but it's multifaceted. In those in which I do believe is true, but this is a aspect, especially how it applies to me and to others like me, that I believe should be addressed. So, so we're going to talk about it from that aspect, and feel free to chime in to talk about yours, Reef. So, I'm sure you will. So, so this article, after I got shot down from the first one,
which was the New York Times, just FYI.
Right. So this was from Street Roots. So I think this is a nonprofit. Close enough. It's written by Helen.
Yeah.
So she writes, so keep in mind, I guess this is an op-ed essentially. The Racist Foundation of American Healthcare Policy. So this article was written in 2020, by the way. But I think, so this was so this was just before the pandemic. But given that we're going to have Trump 2.0 era again, a lot of things I think people were worried about then, people are going to be re-worried about within the next month or so, for sure. So I think it still kind of applies. But anyway, today it's Trump's ban on immigrants who need assistance, but medical injustice for people of color has roots 155 years deep. So she continues. On January 27th, the United States Supreme Court voted 5-1 to approve the Trump administration's public charge law, also known as the healthcare ban. News of the decision was largely buried in the flood of the dramatic impeachment headlines. The law has been fast-tracked and will go into effect February 24th. The aim is to refuse entry or deport those who are expected, and under the new rules, this can be a subjective, discretionary determination left up to individual immigration officers to receive any amount of food, health, or housing assistance. The new rules will radically expand the government's ability to define individuals with legal immigrant status as public charges, financially dependent on the government, and force deportations on that basis. Medicaid, cash assistance, food assistance, and public housing are all types of public benefits that can now cause a legal immigrant to be deemed a public charge and refuse entry or deported. Zoom out, please.
Oh, yeah, sorry.
According to Immigration Policy Institute, a nonpartisan research and analysis institute on international immigration and refugee trends, the new regulations will have dire implications on the citizen children of immigrants as a result of family separations. They are also likely to affect local economies in immigrant communities as grocery stores lose revenue from SNAP, formerly known as food stamps. There will be negative effects as well on clinics, hospitals, and publicly supported healthcare agencies due to rejection of healthcare coverage and increased reliance on emergency rooms by the insured.
Which, with that new DOGE Act that was passing, is very similar stuff. Sounds like,
right?
Benefit cuts and all that stuff.
Yeah. Millions of vulnerable children may be affected as families, fearful of being deported, refuse food aid and healthcare benefits from SNAP and Medicaid. To make matters worse, it was the federal government that heavily encouraged enrollment in these and other federal aid programs in past years. The Migration Policy Institute estimates that more than 4 million legal immigrants who are not yet citizens receive Medicaid. Another 9.6 million live in families which a member, nearly always a U.S.-born child, is enrolled in Medicaid. And as expected and likely intended, the Trump administration's new rule disproportionately affects people of color.
Mm-hmm.
The history of who has access to federal dollars for healthcare in the U.S. and who doesn't has structural roots in the racism that has divided this country since the Civil War, roots that are playing out today in the highest court of the land. The current administration is taking steps that in many ways mirror the direction healthcare policy took 155 years ago, when America created the first federal system of medical care. A look back to that historic time may help make some sense of how racism is foundationally intertwined in our federal healthcare policy and why we are the only high-income country in the world that does not provide universal healthcare, and why those who are white and wealthy are far more likely to remain healthy. The years immediately following the Civil War were rife with epidemics. Slavery had technically ended, but the South was in ruins. Smallpox, yellow fever, cholera, and starvation plagued the camps where freed African Americans sheltered in post-war limbo. Mortality rates were high as mounds of dead horses, the shallow graves of soldiers' hunger, and the lack of access to the most basic health care set the stage for a massive biological crisis. Historian Jim Downs explores this landmark period in American healthcare history in his book, Sick from Freedom.
Okay.
Freed Blacks sent urgent pleas for help, but white leaders were profoundly ambivalent about providing that help, Downs writes. They were worried the smallpox virus and other runaway plagues could affect their own community. They were also reluctant to offer free assistance because they believed it would lead to dependence. Hard work, they argued, was the best and only way to health and vitality for the emancipated. So, in other words, pull yourself up by your bootstraps in terms of
Right.
your health.
But I mean, I feel like they did that at that time. They weren't giving federal assistance to anyone else either. You know?
No.
So, you know, and it was at the time where the union especially didn't have a lot of resources. You know? So, like, I mean, polio, I felt like was a little different, but that was way later. So,
Yeah.
but anyway,
in response to the dire conditions, rising mortality rates, and the real threat of viruses breaking into white communities, Congress finally set up a medical division for the Freedmen's Bureau. This was the nation's first federally funded healthcare program. Though
okay,
half-hearted, only 120 doctors and 40 hospitals were provided for nearly 4 million freedmen, women, and children. It was a significant action. I spoke with Downs about the roots of our national healthcare ethos. Enslaved people became free in an environment plagued with disease and sickness, Downs said. We ignore that history. We want a triumphant motion of freedom and emancipation. But people of the time witnessed those forms of suffering and in an unprecedented move decided to call upon the federal government to help. This is all before the creation of the welfare states, the creation of any type of relief effort from the government. It is a tragic history because of the high rates of mortality, sickness, and suffering, but it is a triumphant story in some way because the federal government acted in a way we have never seen it act before. I mean, I think he kind of downplayed it a little bit in terms of, like, that's what government is supposed to do,
right.
at its core. But they didn't want to do it because the blacks, though. But anyway, scroll down, please.
Yep.
The real motivation for providing healthcare had been to get formerly enslaved people healthy again for the agricultural labor force, where they were sorely missed. That motivation is still threaded into our present day insurance practices as well. American national healthcare carries an implication about political economy, Downs explains. This is mirrored in our present day practice of employers providing healthcare insurance. Zoom out.
Yep. I clicked a button, but it didn't go. There we go.
Why do employers provide health insurance, Downs asks? Not out of a benevolent concern. They're doing it to protect their workforce labor, to protect their investment.
Right.
The idea of federal aid was revolutionary, but the actual execution lacked teeth. The scant federal health care relief programs set up following the Civil War were quickly dismantled by the former slave states, which formed a voting bloc that wielded enormous political power. So remember, back then, these were Democrats, not
Carpetbaggers and
Republicans.
whatnot.
Right. Yeah. That bloc preserved the nation's racial stratification by securing local control of federal programs under a mantra of states' rights and, in some cases, by adding qualifications directly to federal laws with discriminatory intent. Janine Interflandy wrote in an article for the 1619 Project, a New York Times Magazine initiative exploring the consequences of slavery and the contributions of Black Americans. The pattern of racial discrimination in the American healthcare landscape became entrenched in the years to come. From the GI Bill, which essentially excluded Black service members and their families from benefits following World War II, to the American Medical Association, which barred Black doctors and supported restrictions on medical education for Black students, federal and state policies have continued to mirror patterns of racial disparity and inequality in healthcare. Fast forward to the new healthcare ban for illegal immigrants. Downs addresses the limbo of immigrants who, like freed African Americans, inhabit a quasi-realm where citizens' rights and human rights are ill-defined. In today's climate, medical rights are human rights is a weird formulation, but the question is, what does human rights mean? Down told Street Roots. What they are trying to do is incorporate it as an argument of citizenship and responsibility of the state.
Yeah, I don't know if it's a weird formulation. Every other country seems to think it's fine. But,
right. Down sees the plight of children at the border as directly analogous to the experience of Blacks after the Civil War. An analogy of the Black refugee experience that no one is talking about is the experience of children at the border dying of flu. It's the same idea. It's not about citizenship, it's about occupying a political space, and therefore we don't have to respond. Why are the children kept at the border? Because they're waiting for their hearing. They are kept in a refuge situation, and as a result, they are in conditions leading to the outbreak of disease, and they are dying. There was a case in December of children dying of the flu. They had nothing but these aluminum sheets to place over them. As the country politically works out what will happen to people at the border, having that amorphous political space has immediate health ramifications. That's what happened after the Civil War. Black people didn't have citizenship after the Civil War. They were non-enslaved, but they were not considered citizens. They were in an amorphous political space, and that leads to medical consequences. If you are a human living in that amorphous state, you're more susceptible to disease, Down said. Street Roots spoke with Professor Evelyn Hammonds, former dean of Harvard College and a professor of science in the African American Studies at Harvard. She said she supported the historical arc laid out by Downs. The fact that we ended up with the fragmented, unequal health system that we have is directly related to institutional racism, she said. We've created a healthcare system as it was built over the end of the 19th century, and an increasing large hospital system across the US through the 20th century that is ridden with inequalities that represent the unequal distribution of healthcare. And certainly the question of who gets to demand that state, city, federal government provides for healthcare for all citizens is still a contested question. What most people don't recognize is the absolute way in which inequality and unequal distribution of health is built into the system. That is just structurally what people tend to miss out on as you look back over the long history. In the light of a new Trump policy, perhaps the Statue of Liberty should be rewritten to say, give me your tired, your poor, you huddled masses yearning to breathe free, but only if they have enough money on them to pay for the most expensive healthcare system in the world.
Most of them don't.
Right.
Because who can?
Right.
You know?
So I know this was last night you had some thoughts. So if you remember what
I feel like even with this article, which the other article I think gave more into the historical context, you know, it feels a lot of like it's like the cart before the horse, right? It's like I don't think the inequality is the like leading factor there. That's like the problem of the class factor, where the reason those things exist is because capitalism in the first place, you know, and because of you know how race is connected to class, right? There's a reason why you've been subjugated, right? And it's because you, since slavery, you haven't had the opportunities and the education and the monetary freedom, right? On top of labor was taken from you without monetary representation, right? Like all those things over years stack up to where, you know, it's like the same thing with crime rates, right? Like, and or, you know, any of those things where they talk about, you know, minorities being a majority in those things, right? But it's because of the economics, you know?
Right.
Whereas I think this is also because of the economics, and like they're unwilling to fix the economics because they're making too much fucking money off everyone. And they don't care if you die. And now, is there racism in the medical system? Absolutely.
Of course.
Like, I'm not going to deny that shit either. But, you know, I think it's also, if your insurance comes up bad, they also don't care about you either. And the entire system is set up to not really care for you. It's to set up for profit.
I think the argument that some certain people are making is because, well, initially, because, you know, Black people were not considered human in this country. Like for forever.
Yeah.
That argument, like, oh, because they use and that's the idea of race. You have a visible, like, connotation of who you were. Like, now granted, you're white,
Yeah.
you're like, I don't want to give your economic status, but like,
Yeah.
but
Middle
like
class, lower middle class
middle
generally.
class. So like, but people will look at you,
Yep.
may not necessarily assume who you are unless you tell them, or if they're able to figure out from context. From me, they can just look at me, oh, he's black, and immediately like things start popping
Right.
off in their head, especially in this day and age. But I think the idea that, at least with the segment that I watched from Saturday the other night, was because Black people were considered subhuman in this country, and our government essentially didn't want to do anything for them directly, that indirectly affected other people, regardless of race, but also class as well. Like, if you were a poor white person, it wasn't necessarily, or it still is not necessarily a guarantee that you are going to get any help either. And actually, in a lot of the things that was saying in the article, I can make the argument, if you're poor white, well, during the Civil War, it basically was white and black. So like, if you were a poor white person, you probably weren't going to get any of those services either. Especially like if you were an immigrant back then.
Well, and that's my thing too. It was like access to healthcare was being denied, not necessarily funded healthcare. It was like just getting a doctor who knew what they were doing,
Right.
Like, and I don't know if like that would have kept, if white folk at the time were thinking about subsidized healthcare, that wouldn't have stopped them from getting it. They would have made some excuses and or a law that said you guys don't get it because yada yada yada. They did that for plenty of other things. So it's kind of, to me, like, while it's a factor, I would say the economics is like 90% of the issue, 95% of the issue,
Right.
But no one's willing to address those problems either,
No, and I think,
So
thinking about this now, it's like, it's still like, because I think this is in the realm of academia, especially with this article, that they benefit from capitalism as well.
Yes.
So
in a very
it's a
similar
lot
system. Tell me
It's a lot
access
easier.
to education is because like subjugated black folk, and it's like, well, yes and no, no and yes, like all of the above, So
and but to bring it to like someone like Luigi, like, in a moment, the reason why he's getting a lot of press, and I've noticed this is how they're flipping it, is because he is a rich guy that actually did it. Like, he is from means. So the idea that a rich, essentially being in a way, allegedly a class traitor, in a sense of, he was a rich guy, rich young man, or at least born into it, had means, and still did something that you would think someone of a lower class would be more apt to do. So that's kind of why he's getting a lot of talk right now, is because,
well, it's also why they're willing to throw the book at him too. If see, this is my thing about the whole thing. Why they need a head on a spike and a patsy to begin with is because they need to manufacture the consent, which is why they are making it like terrorist charges, which then the precedent that would set would mean that anytime you targeted a individual for political means, that would be terrorism in their mind, So and they could,
I mean, by that, because I
preempt
sent
you
a similar tweet this morning, basically being like, so it's okay for someone like Luigi to allegedly do what he did and be called a terrorist, but it's okay for like the cops to kill me,
Oh,
and I am no threat.
it's more
But
than
that's
okay to
okay.
be.
And then even with that, shout out to Jamie mentioned BB.
Uh-huh.
Like, what is he doing? Like,
Go a
he's doing
couple
everything,
countries.
and we've talked about, made this argument over the last year.
Yeah.
He's only doing this for political points, really, right now, and to protect himself. Like, what he's doing right now, as far as what's happening in Gaza and in the West Bank, that's all economics,
Oh
but
no,
also political.
we've deemed it terrorism. Like
Right.
that whole
That's
pager thing was
terrorism.
deemed terrorism.
Right.
So,
but
not only that, but in Syria, we now have Jalani, right, who we deemed an Al-Qaeda terrorist. Now, we'll just remove that from his, resume. It'll be fine. So, but this kid gets it because, okay, I mean, it's just like, I don't know. I don't buy any of it. I almost don't buy that the dude's dead to begin with. Like they're more than willing to set up some narratives in this regard. So,
well, the other narrative that I saw was like, Brian Thompson came from a working class. That's kind of the shift that they're making. It's
right.
like, oh, he was working, like a small town, like working class guy who moved his way up to the top of the ladder, and he was just a good guy, and it's kind of like, this dude was being looked at for insider trading, which they don't mention.
Yeah.
And I'm going to say allegedly, but
I mean, it's at that level. At that level, all of the trading's insider.
So, but to kind of make that contrast, like, oh, he was a working guy who worked his way up versus a rich, and like the intent, I think it's like a spoiled rich boy.
Yeah.
Who is privileged without a care in the world. But the argument, like, even there, like, assuming that he did have health issues, that was kind of like the equalizer for him, in terms of what he went through personally and how that affected his life, and maybe affecting the lives of other people, or at least being able to witness that would allegedly lead him to doing something. But I think you're right. And like, again, I think in the realm of going back to what I was originally saying, academia benefits from having a capitalist take. It's easier to talk about race because that's the thing that you can sympathize
especially with Trump. Like, they make Trump into this big racist when really he's just a giant capitalist,
Right.
And the capitalism then makes him racist, So, in practice, you know what I mean? Like, that to me is the thing with a lot of this, especially from progressives. You'll hear every phrased way to say that, it's because of like race and or gender and or, sexuality, but really capitalism again. And they don't want to make any changes to address that part. So, but anyway, you brought this bit.
Yeah. So this kind of goes along with what the article is saying. So this is kind of another op-ed piece from Now This.
Yeah.
But even what, I forgot the name of this doctor. But even what he's saying here, in terms of the disproportionate way of how Black Americans are affected by healthcare, if you look at what he's saying, it affects other people of color and poor people too.
Right.
So, like, it might be a little heightened within the Black community, but
yes,
it still applies to everyone else if you don't have the means to, if you don't have healthcare or have limited access to care. So you can play this whole thing. It's about 3 minutes. So
let me go ahead and do this for antis.
Compared to white Americans, Black Americans die prematurely from all types of diseases. George Floyd, Trayvon Martin, Ahmaud Arbery. These have all become household names, but for all of the wrong reasons. Hearing about a Black man being shot by law enforcement in the United States has unfortunately become the norm. What cell phone cameras and surveillance footage fail to capture are the injustices spread out across all the various sectors of our society. As an emergency medicine physician, I practice in facts. And the fact is that compared to white Americans, black Americans die prematurely from all types of diseases, including diabetes, hypertension, strokes, and of course COVID-19. A recent study by Cigna found higher rates of childhood obesity, cancer, diabetes, and heart disease amongst blacks, linked to the lack of economic resources, limited access to care, delay in treatment, and lower health literacy rates. Even when all the variables like location, age, and economic status are accounted for, black Americans die at a quicker and faster rate in our healthcare systems compared to white Americans. Black newborns die 250% more often than white Americans in our country. Black Americans between the ages of 18 and 49 are twice as likely to die from heart disease than whites. You have chest pain, you show up to the emergency department. Well, if you're black, you're going to be waiting longer for that life-saving initial EKG. Black men are 50% more likely to get prostate cancer and 200% more likely to die from that prostate cancer. These trends hold true for diabetes, hypertension, strokes, and so many other diseases across the spectrum. Many physicians have preconceived notions leading them to believe minority patients won't comply with medical recommendations such as incorporating exercise, and the biases extend to other minority groups like Asians and Hispanic Americans. Senator Cory Booker recently highlighted that black mothers are 3 times as likely to die from complications related to pregnancy compared to white mothers. Recently, Dr. Anthony Fauci was quoted as saying, "The COVID-19 pandemic has shined a bright light on how unacceptable the healthcare disparities are in our country. Conditions such as diabetes, hypertension, and asthma that tend to plague minority groups at a higher rate than other groups likely contribute to the higher COVID-19 death rate. Nationally, African American deaths from COVID-19 are nearly 2 times greater than what would be expected based on their share of the population. From physicians to police officers and politicians, we need to stop and reassess who we are as a country and who we want to be."
I mean, like he's right in terms of the black community experiences he's saying. And again, I know this personally. My dad is in remission for, well, prostate cancer.
Right.
That was bad, but like he's in but even now, like my dad has dealt with it now for over 30 years. So, so that's definitely an issue that is personal to me as far as, like a lot of the issues that he's saying. But again, the argument is it's not just limited to black people,
Yeah.
that this is,
Well, and
if you
that's
are
my thing
poor
with this
or,
is like,
right.
well, with this, like everything that they mentioned in this video, all the fixes are economic fixes,
Mhm.
right? That would help people across the board,
Right.
So, like, and Cory Booker ain't doing none of that. Definitely
No.
not now, but
Right.
you
Funny how
know,
he's in that clip mentioning all of this,
yeah,
but he's not for universal health care. He might
no,
be for it if it's like in terms of for a profit motive, sure, but not in terms of like a holistic
no,
viewpoint of everyone has a right to healthcare, and as the government, we're going to make sure that everyone will have it, have the best quality care as possible, and that you're not charged an arm and a leg in order to get it. It
right,
shouldn't matter who you are. Just on the idea that you exist, you have it. So, but yeah, I think, and what I was saying to you last night, I think, is the idea like, because you went off on me, you bring in that New York Times. I said, well, I think even if you can find me an independent media source that kind of speaks of it
yeah,
in those terms,
but they
let me get it.
wouldn't,
And I think,
because they would address the economic issue firsthand,
right. But I think that's kind of what we're missing in independent media right now. And I think even, people in our space is that we still tend to kind of go with the mainstream narrative, which is not always wrong,
yeah,
but if you're not coupling that, and I think it's a lot easier to, do things in like a format like this video or live stream, because it's a lot easier to kind of share your thoughts verbally and visually versus maybe writing them down.
yeah,
But I think the idea still needs to be had. I mean, we talked about Danny Haifon's article from 2 years ago, I believe, with JB, how capitalism equates to racism. So like, so actually, if you want to watch it, you can go to our playlist and check it out. We did that almost 2 years ago from today. So, um, but I think moving forward, that's where we need to kind of talk about that, because it's very easy. Well, it's become political. It's become more politicized in terms of race, and that's where the both parties kind of fight at. It's in terms of race, but but they don't want to talk about it as far as economics, because that affects everybody. And
it affects their bottom
they are the
line
ones
more
who
so.
benefits versus the people who do not. So they want to avoid that issue. But yeah, any last words before?
No, I mean, I find that, like, because I do think that is a factor in a lot of things, but I think it always when I look at it's like when like that kid asking why. It's like when I ask why again, it's like, well, why is it racist? Well, it's like, well, it's because these factors and these factors and these factors, and it's like almost all those factors are economic,
Right.
And it's like,
and
yes.
Don't forget, the idea of race in of itself is a social construct based on what?
Yes.
Economics.
Right.
So I think that's what we need to kind of get at is,
keep
race
in mind,
is a visual marker, allegedly.
It was the slave trade.
Right.
It was the trade part that was the important factor. The Civil War was based off the economic factors, not the freedom fight, like not any of that. They didn't care about the morality. They cared about the economics. Right. So, which we're constantly fighting with.
So, but I think even in independent media, there's this lack of, I don't want to say, I think it's unfair to say lack, but I think we need to kind of hit that message a little harder in terms of it's about class. It's about class. Yes, race is a part of that, but even that is related to class too, because as I said, it's a visual marker of allegedly where you stand economically, which may or may not be correct. And
which the other factor with universal healthcare right now, and this has always kind of been a factor, but especially recently with how the Biden administration handled the COVID epidemic and the Trump administration handled the COVID epidemic, on top of lots of, shady economic think tanks want control of healthcare for very unsavory reasons. This government and or a new government, it's like I'm a little amiss at giving them control of a universal healthcare system, and any universal healthcare system that Congress would enact at the minute, or even in the next 10 to 15 years, we're going to have to keep an eye on that fucking fine print, because there's going to be a lot of problems in there. So, just keep that in mind. So, like, that's just my 2 cents on it. And I have always been a big, giant supporter of single payer healthcare systems, as well as a lot of other super commie idealistic things. Like, I'm here for UBI. I'm here for a lot of that crap. Because I know that the amount of wealth that we make as a populace, if shared among the populace, we can all be fashionably wealthy, right? Like, if you just split up the GDP of the United States evenly, we're talking people getting millions and millions of dollars for themselves, all of us. So, that's the way with the AI, the automation, all that stuff is, you got to pay attention to the economic stuff here. So, but until people are wanting to fight on those terms, it's going to be tough trying to get anything done. So, but keep in mind, it also took one guy with a plan to get everybody talking about stuff. you know, and I'm not saying do anything outside the law, but sometimes I think we need to make those pocketbooks more afraid than they are. So, you know,
Right.
think about some inventive stuff, you know, but, you know, otherwise, good luck out there, fam. We're going to need it. So, but
which is why having these conversations is why we're demonetized from YouTube. So, if you want to support us financially, otherwise, please feel free to scan the QR code if you have the smartphone. If you have a smartphone that you see on your screen, or you can go to the link that you see at the bottom there at ko-fi.com, and you can make a donation as little as $1. We know that this is the holiday time. Jesus, next week. So you're doing last licks of getting the things that you need for your families. And as we say all the time, you know, take care of yourselves, take care of your families, take care of your communities before you give to us. But if you have a couple extra bucks that you want to kind of donate to us, we would be more than happy and appreciative for that. As we said, because YouTube does not monetize us, we're not featured in the algorithm at all. Even though we think that our stories are valued and important. So the only way that we're able to get any recognition in terms of what we're doing here is by viewers like you. So the way you can do that is don't forget to like this stream or like this clip once you see it after the stream. And be sure to subscribe to us so we're able to continue to grow. So maybe their algorithm is like, oh, they actually are doing good shit to help fight the suppression on YouTube. And make sure you leave a comment. We do read them, even though I shouldn't say we do read them. And we do take note of what people are saying. And I think a lot of you have a lot to say over the last few months. So we really appreciate that. So it definitely helps formulate future stories as well as discussions that we like to have live. And help us get to 3K. Hopefully we'll hit that in the first half of 2025. But as a way to continue growing and supporting our colleagues in the network as well as independent media. And thank you for watching. We love you.